As healthcare moves away from traditional fee-for-service models, providers need a strategy to stay competitive. That's where Strategic Healthcare Partners comes in. We offer expert consulting and ongoing management oversight for providers looking to form an accountable care organization. From financial feasibility analysis to helping you choose the right ACO in a crowded market, SHP provides the clarity you need to make informed decisions and transition to value-based care. Learn more at shpllc.com.
Welcome to Beyond the Stethoscope, Vital Conversations with SHP, where we dive deep into the future of healthcare. I'm your host, Higgins, and joining me today is my co-host, Jason Crosby. Today we're thrilled to explore the AI health revolution and how it's already shaping the industry. From smarter hospitals to better patient outcomes, the possibilities are endless. And we've got news articles stacked higher than a tower of circuit boards, all highlighting how companies are planning to implement AI to help make AI smarter, safer, and better for staff. So let's plug in and explore this electrifying topic together. With AI, who knows what the future holds? We may not even need stethoscopes anymore.
So are you ready for this vital conversation? Let's get started.
Well, hey there, Jason. How are you doing?
Well, good morning, Aaron. That's an interesting voice you're talking with today. I wonder why.
We'll turn it off. It's entertaining, but what we're going to talk about today is AI. And it's all over the news right now. And normally in this episode we do our news articles, but it seems to me there are just so many news articles. I feel like we need more of an overview of AI in healthcare. So I know you sent me some news articles, and I sent you almost the identical ones, and we got a chuckle over everything is headed towards AI. Let's talk about your understanding of where we're at and what some of the news articles that you've read about this seem to be leading.
Yeah, I'll tell you, just in the last week, a lot of the future of hospital, future of healthcare, telemedicine, those types of articles sort of piqued in interest, right? In particular with GPT versions being updated here recently, and Microsoft in our industry adding it on to their product Nuances, right, that they recently acquired. And so with that, you started seeing a little bit more, okay, well, healthcare, how's healthcare going to utilize this versus the academics type of settings that we typically read about, hear about, and that sort of thing.
Right. And all the nerds are using
all the nerds, right? That we're using the cheat, right? And as the dad of a college student, I've already warned mine, don't even try it, that they're on to you. But on our side and in our industry, there's got to be a lot of use for it because we always talk about efficiencies and automation. And to Microsoft's point, where they tested it as part of, physician notation, and that was their testing grounds to add that capabilities, that makes a lot of sense. And then you start seeing things along the lines of, well, how can we incorporate that into the billing, collections, revenue cycle side where the consumer starts getting involved, where I know you and I have had lots of discussions on the patient engagement side. But yeah, even Bill Gates recently with his, Gates Notes came out with a long post this week on healthcare. And so definitely lots of movement in our industry when it comes to the AI component.
Yeah, it's interesting you talk about Bill Gates. Now, Bill Gates hasn't been directly involved with Microsoft now for several years. He's been off doing his own thing. So Microsoft announced this week a collaboration with Syneos Health. They're a biopharmaceutical, clinical evaluator. And so the whole thing is they're going to use AI to help do their clinical trials, which they feel will speed up tremendously, the reading of the results and pulling together data, but optimizing who in their patient cohorts they're actually doing their studies with. So this could be huge in terms of just speeding up the amount of time that new discoveries are made and then pushed to market. That's the sort of thing we're looking at here with AI, more than speeding up note taking, which I think is also huge. But how can we start delivering new healthcare solutions faster?
You're right. And in his notes this week to that point, Bill Gates himself, he admits, that probably the largest amount of innovation in healthcare will be things like filing insurance claims, dealing with paperwork, doctor visits, notes. But where his interest is, and obviously through the Bill and Melinda Gates Foundation type of work over the years, is under 5-year age deaths. And of course, in developing nations, where can that be of help, right? And he's talked about efforts with regards to AI-powered ultrasound machines and the minimal training needed there. He's touched on items where, in these underdeveloped nations, where can treatments for AIDS, TB, malaria, things of that nature, to your point, where can that relationship of that new acquired entity maybe speed up such research and treatment?
Yeah, no doubt. I think AI is going to help inform those decisions by taking out some of that mundane level of effort, right? The busy work, as it were, and the pulling together of big data sets and making sense of it and turning it into a decision-making tool. That certainly is, I see its strength in healthcare happening. Kind of tangential to that a little bit is one of the many articles that I read talks about AI is going to take pressure off of operating rooms. And there's a company out there called Lean TAS, Lean TAS, I guess is how you would say it. And their AI is going to help operating rooms be more efficient by looking at surgical cases. How long do certain procedures take on average, and staff time, and what's necessary to be in those operating rooms and that sort of thing. So all of that information that may take multiple people talking and collaborating can be done by an AI and deliver recommendations based off of all that information. And that information may not even be knowable by a human. So this could change how effectively and efficiently we're handling operating rooms.
Right. And you touch on the point to where Gates himself talks about when he first was introduced to open AI back in, I want to say 2016. And it was all around designing an AP biology exam, right? And the point was, okay, the advantages then of AI was around almost how we look at, any kind of data pools type mechanisms today. Something that can go out and pull all this data in a quick format. And it has since evolved to his point of being able to now pull free text data, to articulate data, and combine all the powerful underlying information and being able to spit it back out into something that we on the human side of the machine can actually do something with it. And so it's interesting to look back 7 years from his first introduction of trying to trip up, an exam where I believe it got 59 out of 60. And now here we are just 7 years later, and we're talking about how it can discover new vaccines.
Right. Yeah, breaking down very complex ideas into simple ways for humans to understand, I think, is truly the power of AI. Again, like it's just this wealth. You could almost type right now healthcare AI and get millions of articles, some of which may have been written by AI, come to think of it. But here's another one here in Becker's about using AI in radiology. Bayer, we all know Bayer. They released an article or a white paper about using AI in radiology and what that's going to look like, improving image quality and interpretation of images, and that through their use of preliminary AI, they've been able to have a far higher success rate at detecting cancers, at finding breaks that were missed by humans, So I think that's certainly going to improve patient outcomes. So we could talk about patient outcomes here and the use of AI. Humans and AI to a certain degree is flawed. I'm not saying it's perfect. In fact, just the other day, Google just released Bard, and you have ChatGTP, and Microsoft has their Bing version of ChatGTP. And someone the other day made all three of them disagree with one another by saying each one of them had been turned off. So they're not perfect. Obviously, Bard's still running, ChatGTP is running. But this can certainly be a helper. We're still in the early days of large language models. We're still in the early days of AI. I can certainly see this as being a helper to help catch things humans are going to potentially miss. So I think that's wonderful for patient outcomes. If we can catch cancers even earlier than before, we have a higher rate of success in treating them.
Right. It certainly feels like whether it's enhancing imaging, ultrasounds, as we mentioned, or vaccines, it is on the more complex side of healthcare. And I think from a lot of what I read too is, and this is kind of how I feel, we're all patients. If there's one thing we all share in common, people listening, us too, we've all been a patient at some point, right? Is where does that impact the everyday healthcare as you go for your annual wellness visit and things of that nature? I feel like it's going to be that next step, that next wave that's beyond the, cancer drugs and treatments and AIDS vaccines, things of that nature. Is where does it kind of translate to the every day?
Yeah. Well, I kind of think about how AI, it's going to take care of a lot of the busy work, a lot of that stuff that staff hate doing because it's boring, it's rote, it's routine. If that sort of thing is gone, then what are staff going to do? And I think that's going to free up staff to do things that people care about more than algorithms and more than, figuring out what does this test result mean. I think that's going to lend staff to provide a better patient experience. Because at the end of the day, if everyone is using, I don't know, the medical version of ChatGTP or whatever, fill in the blank, then it almost won't matter where you end up going because you're going to have your health needs taken care of. But what about your needs? What about your experience? Several podcasts ago, we had someone on, Scott Regan, talking about the patient experience. So I think in an AI conversation, we need to talk about the human side too. What does the patient experience look like in a post-AI world?
Right. And if you're going to your primary care visit or specialist, your first introduction is the phone call. I'm scheduling my appointment. Your next exposure is you go to the practice or the hospital and all of a sudden you're in a waiting room. None of us want to go do those things, right? We have to take time out of our day. We're going to miss work, whatever the case may be. And so I feel like there's an enhancement of, I need to be further engaged by that facility or organization to have a positive experience. Because if I walk into that waiting room, to Scott Regan's point, I'm glad you brought that up. If it's a kind of a dull looking waiting room, magazines are 2 years old, they're irrelevant, and I'm just basically sitting in a hard chair before I even see, the physician 30 minutes later, I've already got a negative experience there.
Right. And odds are the differences between the two pictures have already been circled by somebody else long before you got there. That's right. It totally ruins the whole experience.
That's right. So how could AI help when I schedule that appointment? And maybe it's not myself, maybe it's my primary care making a referral to somebody, right? How's that step start with AI to make it a more positive, streamlined, efficient process? So I at least feel like, okay, there's a difference here before I even walk in.
Yeah, I think certainly AI will be useful in those cases too, because my number one complaint with my primary care provider, I have a 1 o'clock appointment, right? And I think I speak for a majority of the audience. You have a 1 o'clock appointment. You don't see them until 1:50. And that's because they're all backed up. If we can introduce AI into the efficiencies of those visits, we can speed up that time with the patients and we're still providing better, more efficient care. So I think from that standpoint, that's a win. That's a win for everybody. That's a win for those who are going to arrive on their appointment at time, and the doctor will also be on time. But again, it leads into that patient experience. It's not just the wait, right? It's everything else. So we've taken care of all the busy work with AI, and I think this is where the human element needs not to be forgotten about.
Very true. Whether it's, and you're right, you touched on a good point. There's the cascading effect. If we make the front staff work more efficient, if we make the physician's process more efficient through note dictation and that sort of thing, we as the consumer will ultimately benefit as well. But as you and I recently went to we had an epiphany. We went to a Savannah Bananas game. And for those listening, if you haven't heard of the Savannah Bananas, I'm not sure what rock you've been under, but if you haven't,
it's the internet's favorite team, that's for sure.
It is. And we're fortunate enough to live by the Savannah Bananas, so it's easiest for us to attend. But we went recently on a company retreat, and I think we both made the notation as soon as we walked up to the facility, right? So we hadn't even gone in yet. The equivalent of making our phone call to schedule our appointment at physician practice, right? We were already in a positive mood about the experience before we stepped foot in the facility, before the first pitch of the game. How can we translate that into healthcare to where, how does Banana Ball run your healthcare facility type of setting like Disney? How can that translate with BI into a more positive experience as well, to your point about the human element?
Right. Well, a good example in pulling from Mr. Jesse Cole, who's done fantastic work with creating the Savannah Banana image. He's always talking about fans first. I think we can take his lessons and apply it into the healthcare world so we don't lose that human touch. And I think this is even more so important in the post-AI healthcare world, is we don't lose that human connection. We don't lose that human touch. When you go to a Savannah Bananas game, gates open at 5:30. But the game doesn't start until 7. But there are people who are there at gate open, and they're not going to just sit in the bleachers for the next hour and a half bored out of their minds. Jesse has entertainment. He has music. There's a lot of energy already going on, positive experience, unique experiences that you can only have within the stands at Grayson Stadium. You can't have anywhere else. And Jesse's very cognizant and aware of that. Everything from his all-you-can-eat burgers and hot dogs, probably not the healthiest thing to have, of course, but hey, you're at a baseball game, calories don't count.
Yes.
And he's very much thinking, what is the experience going to be like? And so he gets people captured, so to speak, for the next 4 hours, because they're coming there at 5:30. The game was only 2 hours long, so it's over at 9 o'clock. So for effectively 4 hours, Jesse Cole has thousands of people captured, and they love it. They enjoy every minute of it. So I think there's lessons there to take away and apply to a post-AI patient experience. Otherwise, I think it becomes extremely dry, extremely sanitary in the sense of the experience. It's like, oh, well, that will all this efficiency, right?
I'm glad you bring that up, because if you think about where do you start? I remember we posed that to Scott Reed in that first podcast. So Scott, where does the administrator start? Well, let's start there. Where should we start? Well, if you look at Jesse and why he started Banana Ball through their Fans First organization, right on the homepage, it talks about what do fans, I want to say hate, not like, about the typical baseball experience. And he took those things and crafted the 10 rules of Banana Ball. Mm-hmm. And so I would think we could do the same thing as, okay, what experience do you not like about going to your provider for a basic appointment? Take those 10 things and turn them around like he did with Banana Ball. To your point, all of a sudden you're there for a few hours for a 2-hour game, and he's got all these fun rules to keep you engaged. I would think the same thing could be said for you and I going to see our physician for an annual wellness visit.
That's right. And I think AI can be behind the scenes helping to make that efficient. But if I don't have to think about it's AI controlling the visit, then that's fantastic. And we need to make sure that we don't get to the point where AI is driving the visit, and we know that AI is driving the visit. And AI needs to be back in the background and transparent to the patient. It just magically happens.
Well, on that note, I know we're wrapping up the news segment. We look to have some more discussion on Jesse Cole and the Savannah Bananas. After our experience, we walked with a lot of positive thoughts there. And so hopefully over the next few weeks here, you'll have a lot more on our podcast and social media to highlight how we think that transitions into healthcare with what he's done with the Banana Ball.
Yeah, I certainly want to talk about some of the more nuances in healthcare, because not every practice is the same, right? It's not necessarily a cookie cutter approach, but I think we want to talk about more broad strokes that you can dial in for your individual practices. And I really look forward to those conversations.
Fantastic. Well, Aaron, good conversation about AI. I'm sure it won't be the last. Probably something we revisit quite a bit, and looking forward to our How Banana Ball Influences Healthcare series that we look to expand on here soon.
Well, remember, Jason, AI is the future, and the future is here.
Fantastic. All right. Thank you, everybody, for listening. Have a great day, Aaron.
We'll see you later, Jason.
You've been listening to Beyond the Stethoscope, Vital Conversations with SHP, a production of Strategic Healthcare Partners.
For more information about our podcast, including back episodes, show notes, transcripts, and more, visit our website at shpllc.com/podcasts.
And I know you've heard it before, but please consider rating our podcast in your favorite podcast app. It helps make others aware of the show.
And our podcast wouldn't be possible without our wonderful team of folks.
Editing and production assistance by Nyla, Wiebe, and myself, Aaron Higgins.
And your episode hosts are Aaron Higgins and myself, Jason Crosby.
Our social media coordinator is Jeremy Miller.
Our executive producers are also our principals, Mike Scribner and John Crew.
For more from SHP, consider following us on social media, including Facebook, Twitter, and LinkedIn.
And as always, thank you for listening, and have a great, wonderful day.
You already know that understanding your data is key to improving patient outcomes and financial performance. But how? At Strategic Healthcare Partners, our analytics services help turn your EMR and other data sources into actionable insights. From identifying areas for improvement to guiding you through implementing changes, SHP supports you every step of the way. Our performance analytics service dives even deeper, providing custom reports that help you stay ahead in the transition to value-based care. Unlock your data's full potential with SHP. Learn more at shpllc.com.